Hi, everybody. How are you guys? Hello. Good evening. How are you?
Good, good. Can you hear?
Thank you so much. Thank you so much for agreeing to go live with me. I feel like hair has been such a big topic during quarantine with people writing in and saying that their hair is falling out and what to do about it. And I thought it would be a good time to join an expert like yourself and get into it a little bit.
Sure. Thank you for having me. I totally think this has been the weirdest time in my life, and I'm sure it's the truth for most people. And the stress is real, and hair loss is real. Uh,
Yeah. Are
but
you in New York City?
I'm back in New York. I was in
Yeah.
Connecticut a little bit, and that's where I grew up. So,
That's another thing we have in common. I think we're both Connecticut born and bred.
yes,
Um, and I was at NYU for medical school, so part of, you know, it's good people there, you
that's
know.
both places.
So I mean, so many people want to know about hair loss. And for me as a dermatologist, and for the people joining, I guess we could introduce ourselves. Why not?
Sure.
Go
Like,
ahead.
no, I was gonna say you go first. It's your place.
Oh, so I'm Dr. Morgan Rayback. I'm a board certified dermatologist, and we're talking about as much hair topics as we could get through with the questions that people wrote in the next 30 minutes.
Yep, I'm Dr. Ben Paul. I did ENT and facial plastic surgery and realized pretty early in my facial plastics career that if you can get the face beautiful but the frame is off, that it's worth tackling. And so I became interested in hair for that reason.
Oh, that's interesting. I was going to ask you about how you got into it. This is not vodka; it's water. No vodka here.
Yeah,
Um, you know, as a as a woman, I feel like you spend the better part of your life worrying about hair that's in all the wrong places.
yes,
Um, and so, I really feel for people that have been writing into me and saying that, during this quarantine in particular, they're noticing gobs and gobs and gobs of hair falling out. So I thought we could talk a little bit about that,
right.
um, and we could get nerdy. I see some doctors joining, so sometimes I get into the nitty gritty. But cortisol is a big issue right now.
Totally. So, I mean, I think routinely in the office, the most common hair loss that I see is androgenic alopecia.
Right,
And then I see some telogen effluvium or shock
right,
loss for those who
right,
are not doctors on this. And shock loss happens when the body's stress response is expressed in a physical manifestation. And probably there's high cortisol and hair sheds. And it,
right,
it can take a few weeks for it to start. So I've even noticed in
right,
the last few weeks way
right,
more hair stories than in the first few weeks of the quarantine.
right. Right, exactly. I had one person, I did a little Insta story, and I had one person write in to say, how do you know how many hairs um, does it take to decide whether or not you should call your doctor, right? And usually what we say in the dermatology world is 100 to 200 hairs even a
Right.
day.
Right. I say 50 to 100, but 100 to
Okay,
200 is probably more accurate because hairs are
right,
falling out that you're missing.
right,
But at the same time, most people don't go through life aware that they're shedding 100 hairs. So something's
exactly.
changed to make them aware.
Exactly, especially for people that may not wash their hair every day. If they wash their hair every 3 days and then they see, 200 hairs, it could be actually very alarming,
Right. It's
right?
alarming and it can clog the drain, which is
Right,
frustrating.
right,
In addition to
exactly.
the aesthetic scare.
Um, Now, I've had patients bring me all kinds of goodies in plastic bags,
Yes.
starting from my time at Bellevue, which I'm sure you have too.
Yeah.
Do you actually have people try to collect their hairs to see how much shedding?
Yeah, they do that. I mean, I find that to be useful, but at the same time, if it's a lot or a little, I'm still going to take it seriously. So
Exactly.
it doesn't change it too much other than,
Right.
I just want to be aware uh, of the story and of the timeline. So
Right.
I,
And for like a telogen effluvian, right, or a shock loss now, what would you tell your patients for how long it could take? So this is a tricky thing that I feel like I experience when talking to patients, because sometimes it can be really, really a really long time, you know,
Sure.
and every patient is different, right?
Yeah, 100%. Every patient is different. Although the literature says there's two categories, sort of acute and then chronic. With
Right,
acute, it can be very different. It usually is a few weeks to a few months to start. The shedding occurs for a few months and then it tends to resolve. And usually somewhere between 6 months to a year, you're seeing resolution.
right, right. So I say 6 months to a year, as the year sort of being like the end point
Right.
in deciding, you know, where to take it from there. But I feel like as a provider, I mean, as a dermatologist and you as a hair expert,
Yeah,
you know clinically when you're seeing androgenetic alopecia, right?
sure.
And so, um, you know, how do you decide with the patient? Hi, everybody joining. Thank you, everyone who wants to talk about hair. And if you guys want to write in more questions, we have a lot from my Insta story. How do you decide, how do you approach a patient with when to do a hair transplant?
Sure. So for the telogen question, how do you know if it's telogen in a background of androgenic or androgenetic alopecia? I'm
Right,
trying to understand. I usually will do a little pull testing, and if they're
right,
shedding in a place where they shouldn't with androgenetic alopecia, sides or back of the head, that's a
right,
more suggestive story of telogen. And then you try to look at the clinical, the patient's story, and does it fit? In terms
right,
of when is a hair transplant appropriate? You're looking for a moment of plateau in somebody's life. When
right,
somebody's like, I've had hair loss for 3 weeks, that's not the
right.
right time to transplant.
Exactly,
The transplant
exactly.
occur when my hair has not been great for years. It's not getting worse, but boy, I would like it to get better.
Right.
And then let's talk about women's hair transplants, because that's an interesting topic that I don't think gets enough discussion.
Yeah, I would love to talk about that. Sure.
Sure. So for women, the hairline tends to be maintained, but then behind it gets very thin, and the
Right. So
angles,
basically like the part, right? And then
yeah,
the part kind of
are.
spreads. And I think, for yeah, keep going.
No, so what I'm trying to do is help women understand that with a transplant, it's like the garden needs more plants. So I'm going to plant them, but I can't put them everywhere because it's the number of hairs over the surface area is the density. So what we want to do is use each of those hairs to the best possible advantage for aesthetics, not just for how it grows, but how you can style it.
Right, I got you. I like the gardening analogy. Now, as a hair transplant surgeon, do you also pair the surgical treatment with a medical treatment? Like, what do you think of PRP?
So I think
I want to get into it with you.
Okay, so I have a lot of thoughts on PRP. For those who are not familiar, PRP is platelet-rich plasma. In our blood, there are different cells, and they float around in a liquid called plasma. The
Yep.
platelets are, luckily for us as providers, the least dense cell, and when blood is centrifuged, it rises to the top. By taking a patient's own blood and grabbing their platelets, you have a substance now that it's very unlikely that you're going to reject your own blood or get an
Right.
allergy from yourself. It's an
Right.
extremely safe treatment. And the real question is do we have a target for the platelets or the growth factors inside the platelets to work on? And so if you cut yourself, the platelets stop the bleeding and then they open up in a process called activation and release the growth factors that help with healing. For women with androgenetic alopecia, biopsies of the hair follicles often will reveal a microfolliculitis or inflammation around the base of the follicle. And that would be a great target for PRP. I've seen better results in women than in men. What's your experience?
I'm not a huge fan overall. I think that the science is not a huge wow. I think that, for a lot of, I have more experience. I don't do it in the hair at all. I've had
Okay.
more experience um, investigating it for microneedling treatments, which is
Uh-huh.
basically a collagen, I don't know if you do it, but it's basically like the mechanical
Yeah.
version of Fraxel. So it's basically for everyone that's joining, a mechanical injury through the dermis, where the recovery of the collagen leads to cell turnover and beautification of multiple different aspects of the skin. And so for PRP and microneedling, I don't think that despite the fact that we'd make gobs more money. I mean, we're in New York City and people are wanting it.
Right.
I haven't found a need to add PRP as a treatment, as an adjuvant to microneedling therapy. I think the injury alone, the science backs the injury alone, causing regeneration, and stimulation of the collagen and elastin.
Yeah.
And it just doesn't make sense to me. Like, if you just flood that area with more protein and more growth factors, what if you're someone who makes crappy growth factors? I mean, this may be water, but on the night, the nights after, this might be vodka. It might not, I might not be making good growth factors. I don't think everyone makes the same growth factors. And I think there's a way to buy bottled growth factors that are more scientifically researched.
Mm-hmm.
Again, I would make gobs more money if I did it. We don't do it right now in our practice, but I'm interested to hear about it because there's more research sort of with PRP in the joints, for joints and using, totally. Right. And that's a lot more promising. So I haven't tried it with the hair myself. So I'm happy to talk to an expert.
I'm happy to share. I have a lot of thoughts on this. And so there's 33 studies for hair and PRP at this point, which is a fair number considering.
Yeah.
And the complexity is that some of them are dirty studies. They do PRP on the same day as starting Rogaine or minoxidil or Propecia, or spironolactone. And so now they're misattributing all the benefit to the PRP.
Right.
Happily, there are a few well-done studies, but when you try to compare studies, they're using different systems of PRP. So the spin cycle is different. The activator is a calcium chloride, calcium citrate is different. You're ending up with a slightly different product. So I spent time and I interviewed about the 8 or 9 different companies that are prominent out there. And I came to the conclusion that hair grows slowly, which is absolutely the most bland conclusion. So I want a PRP that I inject that's not just going to hang out for 20 minutes and go away. Many of the classic hyper concentrated PRP systems, 24 hours later, if you biopsy, there's no evidence of growth factor. So how on earth is that going to grow your hair? It's not. It's just not going to work.
No.
So what I was interested in is how do you get the growth factors to stay around? So people in 2016, 2017 got excited about putting A-cell, which is an extracellular matrix derived from fetal pig bladder, into as a scaffold. It doesn't work, and sometimes the body recognizes that you've put pig inside the head, and that I keep joking with the patients, it's not kosher, we're not doing it.
Yeah, I love it.
Right. So then I started thinking, well, there's this thing called PRFM, platelet-rich fibrin matrix, where it literally turns into a gel.
Right. Sort of like I used to do a lot of research in wound healing.
Yeah.
I'm putting my super nerd goggles on now. Actually, when I was at NYU.
There you go.
Yeah, and there was some research in regards to wound healing because the wounds also heal really slow.
Right.
You need something that's going to be around for a while.
Right. So for the PRFM studies, that platelet-rich fibrin matrix, so the growth factors were linked to a glue, the body's glue called fibrin, and they're around weeks later. And that's the only system in my own personal experience that works.
Right. What about, you know what this is making me think of, and it wasn't one of the questions for our people, so I'm going to cheat a little bit. What do you think of the light therapies where you wear like the helmet?
So the light therapy is interesting. I wrote a lecture that I was preparing to give, and I'll show you some of the pictures from the light stuff, and I can show you a PRP picture, which might be helpful.
If you're going to do this like spliced into the Instagram Live, I'm going to be impressed. Technology is not always my
in the most low-tech way, but let me grab this because it could be helpful. I
would have to take the page and kind of lift it up and just get it so. Let me just see. Is it okay? I'm just going to read off some of the questions from my Insta story while you pull this up that are sort of like the fun ones that I thought. Is it okay to blow dry my hair if I'm losing hair? I think yes. Right? 100%. There's nothing that you're going to do style wise that's going to make your hair fall out anymore. Although it feels like that when you're blow drying your hair and you're styling your hair and you see big clumps.
Yeah.
Does shaving or combing lead to hair loss? No, there's nothing you could do to pull it out really, unless you're actually pulling it out, but that wouldn't be fun.
All right,
or metaphorically pulling it out.
Yeah.
All right, getting back to
So
Science.
this is science on PRP. When they looked at the diameter of hair shaft, and this is by month 4, the hairs growing are actually thicker. And more importantly, for shedding, which is what's happening during quarantine, at 1 month after treatment, in the beginning, 10 hairs came out. At 1 month, 8 hairs. By 4 months, only 2 hairs were coming out. And this is with the PRFM system.
For all the people that joining you, we are getting deep and dirty with PRP, talking about whether or not it'll work for, and is this for androgenetic? So is this, what kind of hair loss? This is for androgenetic hair loss?
I think androgenetic in women and telogen effluvium in men and women.
Got it.
For whatever reason, for men, there isn't as great a result. It's not a never statement, but it's I have to really screen the patient and go through the story to make sure I want to try it.
I got you. I got you.
What's interesting is there are women who are androgen insensitive, which means they don't have a receptor for DHT, right?
Right.
And they show pattern of this androgenetic alopecia. The androgen part's not the cause. It's either just genetics or it's genetics plus something. And those patients do awesome when you start modulating inflammation.
That's interesting. So
Yeah.
do you test, is there a gene therapy, like, is there a way to test them, or is this an empiric? So how do you know that they don't have the receptor?
I think that they have found it out through other methods
Right.
in their life. I don't know the way to test for that, actually.
It'd be interesting if you have responders that are really getting like a real like kung pao, you know,
Yeah.
with the PRP, and then you test them and they don't have the receptor. That'd be really interesting. I
That
feel
would
like
be-
we're all slowly getting there.
Right.
We just need a goddamn vaccine now, right?
Totally. Yes.
Great. This is really good.
And then this is my own results of a patient that I did PRP on, and it's interesting just to sort of see it. So in the beginning, you can see the widened part.
Yep.
And then at 2 months, it's the base of the hair starting to get a little thicker. She decides to dye her hair at 4 months, but when you compare the before to the 6-month density, I mean, that's unbelievable. And that was just PRP alone.
Yeah, and you're really super specific about the way you take your photos, as are we, you know, like, you know, because lighting and all of that.
I try to make it as identical as humanly possible.
Right. Yeah, that definitely looks. So it would be interesting to me to see how long the hair lasts as compared to a hair transplant. So and are you doing topical therapy as well?
In some patients I am. The ones that I showed just there are PRP alone.
Oh, I like that. I like that.
Luckily, I have the actual ability to say that, which in the studies, it's very confusing.
Right.
So I would say up to a patient, a PRP treatment with my system works for about 6 months. Hair transplant is the only permanent solution because you're actually putting hair with different genetics into a new spot.
Right.
And
for women with androgenetic hair loss, are you also doing, so what I do as a dermatologist, right? I don't do any of the surgical stuff, right? But I've had success with spironolactone, and I've had some success with minoxidil, which is like Rogaine, but I always use the 5%.
Always. That's a waste of time.
Right. And that's basically it. I have no other tricks. And with the caveat that, you know, people always want to know, can my diet help my hair?
It can hurt your hair, but unlikely is it going to help.
Right. So you know, for me, I'm like, look, if you're a vegan and, you know, you have a really very, you know, minimal diet that's plant-based, then take a multivitamin. It could help. You know, thyroid, obviously, other medical conditions can contribute in addition to androgenetic. Is there anything else topically or orally that you're using? Any like fancy hair pill that I saw?
I actually think the Nutrafol vitamin system is the best one out there. And I really like that they finally have 2 types. They have one for premenopausal and one for postmenopausal women. The one for postmenopausal is a little more anti-androgen. And I think it is, I asked the company, it's safe to use Nutrafol with Spiro.
Right.
which was a question I didn't know the answer to.
Yeah.
And that seems to be winning the vitamin war for patients in my practice. Probably 3 years ago, the vitamin winner was Viviscal, but I don't think
Right.
it's as effective
Yeah.
as the Nutrafol.
Right. I have to look into like the nitty gritty of what those are.
Yeah.
What the actual vitamins are.
For the people watching, is Nutrafol. And the one for men is excellent too, because it has 2 ways of lowering DHT that aren't Propecia. And it's very uncommon for someone to get a side effect, whereas Propecia is a higher risk pill.
Right. Yeah. Yeah,
So
I'm not completely sold on Propecia all the time either.
Propecia, I think, has its moment where it's amazing, and I think
it works. But what do you think of the side effects?
So the side effects, when you look at the history of the pill, it came out in '92 at 5 milligrams, and that's a huge dose. You know, if you drink too much water, it's an overdose. So
right. So now it's it's about 1 milligram.
So if you take 1 milligram a day, that means you've taken 7 milligrams a week, right? Versus 35 milligrams a week. And head to head, it was pretty much the same outcome for hair. So is 7 milligrams the lowest dose? That's the question I've wrestled with patients for the last decade. And I'm finding that you can take less than 1 milligram. And importantly, when you looked at 1 versus 5 milligram, 1 milligram of Propecia brings 1 to 3% side effects, mostly libido issues. 5 milligrams brings 30 to 50%.
Right. Yeah.
It's a huge difference.
I've definitely had patients come in and say, "Look, we have to talk about something," and I'm like, I feel where the conversation is going.
Totally, and it's a tough moment. And you know, the patients will tell me, it's like, why'd have hair if the libido is off?
Right.
Yeah, which I totally get.
You're such a gem. You're such a gem.
Likewise.
Let me see if I can just crush a couple more of these.
Sure. Really quickly, to answer your light therapy, I don't think it works.
Me neither.
The studies are on rat and mice. Their skin is super thin. It's like this. Scalp is thick. It doesn't penetrate.
Right. I think some of the background data on that is if you came from laser, right? Mm-hmm. And just treating people with low levels of laser or not quite the right dose of laser, you could get sort of this paradoxical growth, and I feel like that's where it came from. But I haven't seen I haven't seen it be the promising helmet. So you're really coming prepared.
I know, I came prepared for you.
For all the people following, he put this presentation together just for me.
Only for you.
He's gonna deny it, but he's gonna deny it.
I put it together for everyone. For everyone watching. But so what the concept here is that red light hits melanin. That's called a chromophore, or a pigment that picks up the energy. It warms up the cell, and it increases ATP, which is like gasoline for the car, and hopefully more protein is made. The problem is that it would not work if you have blonde hair or gray hair. And again, the scalp is probably too thick. Some of the devices come with a free curler, and I do believe the curler works. I don't know about the light device, though.
Is there anyone watching that has any questions that they want us to address? There was a couple more. How do I know if my hair is weak? And we kind of touched upon that with the hair pull test, where you could just kind of take a clump of hair and see how much is coming out and talk to your doctor about it.
What I notice with that sometimes is when they mean weak, sometimes their hair actually breaks as opposed to pulls out. So you want to ask, what is the actual question there? If you're breaking your hair, then you're dyeing your hair with a dye that's too aggressive and breaking it down, or you're putting some substance on your hair that's not agreeing with your hair, and you want to build up its strength, not cause it weakness.
Okay, so that's a good one for you. Do you have any topical shampoos or things like that you like to recommend to make hair stronger?
I think that the keratin ones are the most common that people will pick. I don't have a shampoo brand that I'm completely wed to. I love the products of Rita Hazan. I think she's done a really good job with her shampoo. If you're itchy, I think Nizoral is
it's the best over the counter.
It's amazing.
Like Sebderm, the flaking that comes from your scalp, which is not actually dry skin. It actually comes from yeast on the scalp. Nizoral is the best over the counter stuff. In fact, I think, 2 out of my 3 kids I use Selsun Blue on, and they kind of look like Smurfs for a while. So it really is effective.
Do you have a favorite shampoo?
I like the Isden brand shampoo. It's sort of a slightly different molecule than minoxidil. It comes from Spain. This is not an ad, although if you'd like it to be, Isden, come talk to me. I'm just joking. They're not watching. But I just like to preface it because I feel like we get approached all the time. And so I've actually tried the shampoo myself, and it's a little bit more elegant than the typical Rogaine. And they have a shampoo and a lotion, slightly different molecule. I feel like I've met my match in science right now.
No, it's
With
good. It's
you.
collaborative.
Slightly different molecule, but works, I think, as well as Rogaine. It's like a sister molecule, kind of like this port Botox.
Do you rinse out that shampoo?
You do. You do rinse it out. So you basically put it on, leave it on the scalp for like 10 minutes,
yeah,
and then wash it out. But then it has a lotion as well. That's a leave-in.
That's really cool. So the lotion's probably going to do more, because a lot of the DHT blocking shampoos, if you're going to rinse it out of your head after a minute, if that, on your scalp,
Right.
probably not enough residues left to do its job.
Right. I mean, I think for it's more probably like in a, you know, like you're doing something,
Yeah.
you know.
Sure,
just
sure,
like
sure.
quarantine, you want to feel like you're using the right stuff, you know.
Yes. What other questions do you have?
Let's see, from my guys. We crushed a lot of them.
Good.
Yeah, I think we got it. Do you have a preference for women? Do you always do? I know we've shared some patients, and I feel like I've always seen the scalp in the back.
The strip?
Yeah, the strip. Do you have thoughts about that versus the individual? Do you want to just touch upon that?
So there's two major ways that hair can be taken out from the back, which is the normal donor site during a hair transplant.
Yep.
And in women, the strip does unbelievably well. It's so reliable. And the chance of you seeing that line as a woman is so low. You can wear your hair short, a ponytail, a split ponytail. It's not going to be visible. To do the FUE, or the single hair extraction, the hair has to be so shaved, and it is it's shaved like that much. And to do that to a woman would be really tough, because like it'd be years before their ponytail grew back.
Right.
But for instance, this is a patient before a strip and after a strip. My own patient. It's at that length. You can't even see it with almost, very little hair. So it has not been an issue. This is how it looks closed on the operating room table.
Right.
And that's with the hair pulled up over it. When it falls down, you really don't see it.
Right, exactly. Yeah.
I will
someone was asking me who had, the husband and wives that go in for the transplants.
Yeah.
They always stay together, and one process for one may not be the same as the process for the other, depending on findings and etiology and what their actual anatomy looks like.
Right. If a woman has a small area, this is a woman that I was working on her eyebrow. So you can see I'm taking the hair out, and I just lift a little window up, and it can be done. And you can see the improvement in eyebrow from transplant.
Right. Do you take the transplant? We had a patient, me and Dr. L had a patient a number of years ago that went through the the plastic shields in the taxi cab.
Oh yeah.
And she had a facial nerve palsy, and she had a skull fracture, and we rebuilt sort of the top part of her face. And then I did, my part was the scar, the skincare, and then because she had a partial facial nerve palsy, which is, we could do just a touch, like 1 or 2 units of Botox on the other side, just make her symmetric. She was thrilled.
Balance it out.
And she wound up doing a eyebrow transplant, and it was phenomenal just for symmetry. Is that where's the hairs from though for that? Remind me.
For eyebrow?
For eyebrow.
Usually the lowest aspect of the hair, almost near the nape of the neck. And somebody asked, how long does it take to recover? The hair is placed all in one day. It's awake with local anesthesia. Local is like Novocaine that the dentist gives you. And the hair will grow for a few weeks. You don't want to pluck the hair. You can trim it. And then it falls out, it rests. Usually the results that I'll show online, I'll tell you how long they are. But it's about a year for that change. The hard part for an eyebrow transplant is that the hair
The
on the
hairs
neck
get really
grows
long,
and grows
right?
and grows. And so
Yeah.
you are signing up for a ton of maintenance. I would definitely recommend microblading before an eyebrow transplant, and see if you like it.
And do you guys do that in your office? Any of the tattooing?
I do scalp micropigmentation, which is
Okay.
pigmented dots.
Okay.
It's a home run for almost everyone,
Right.
women, men. I mean, part of
Right.
the issue is that they don't have enough hair, but part of the issue is that they're seeing scalp. And if you
Right.
darken the scalp, boy,
Right.
it
It's
looks so
awesome.
good. And it's
Yeah,
instant
it's really
gratification.
that technology has come so far.
Oh my goodness. It's like, it's an art as well. And the people I have that help me are tattoo artists in the best
Right.
sense of the word artist.
Right.
They're not putting dragons up on people's heads.
Right.
Um, and uh, and it's something where with a hair transplant, when you take it out of the back, it doesn't grow again. But
Right.
with the ink, we have an unlimited supply.
Right, exactly, exactly. Well, thank you so much. I know I said 30 minutes, and you're just so fun to talk to. It's
Oh,
gone for a
pleasure.
minute, and thank you for everyone who joined.
Well, we'll have to do something in person once we're allowed.
So, absolutely.
All right.
I hope you have a good rest of your quarantine. Hopefully, it's shorter and shorter, right?
Yeah, I
Are you
mean,
guys planning to open up? Are you? I'm sure you're doing telemedicine.
telemedicine is 100% active as it has been. We're seeing emergencies and urgencies in the office. We're not doing any procedures right now.
Right,
For hair transplant, I have an incredible number of people who didn't get their procedure in March and April
right,
and in the start of May. So, and then
right,
there's people booked in June and July. It's very hard for me to figure out how to do everybody's case. I actually am looking into getting space with a colleague in Westchester right now, just for transplants. And then because Westchester, they're letting procedures happen, and I'm board
Oh, that's
certified.
so interesting. Dr.
Yeah.
L just had a patient offer to helicopter out to the Hamptons to do a bleph under local. And we're like, absolutely not. Like, I'll
Yeah.
pay you twice the fee. We're like, absolutely not.
I know
So
that
we
is,
gotta just,
yeah.
we gotta stay safe, stay home,
Right.
do
I'm
our
not
part.
I'm not doing a hair transplant in somebody's house, but if it's in a medical facility where I can get
Yeah.
credentialed, sure,
Yeah.
that's different.
Yeah, absolutely. Well,
So,
thank you so much for joining me.
pleasure.
This was really fun and very
Yeah.
informative.
Say hi to Dr. L for me.
I will.
Okay. Bye, everybody. Thank you
Bye
for
bye. Bye bye,
participating. Bye.
everyone.